Mike Jachles, Jachles, with the Florida Association of PIOs. We are working for the Division of Emergency Management for the state of Florida. A couple of things. First, I'm just going to give you the numbers for today, go over the criteria here, a look back at the week with the new criteria, and some of the things to keep in mind. So, for Sunday at the Hard Rock COVID testing site, there were 319 people that were tested. On Saturday, there were 641 people that were tested. 206 vehicles today. That brings a total of people that have gotten tests taken here at the Hard Rock site to 13,830 since this operation began. One of the things we want to do is make sure that people know that the information about each test site is specific to that test site. The last thing we want is people to come out and not be able to get a test because they don't meet the criteria. So first, we'll review the criteria here since it's been revised. If you have COVID symptoms, regardless of your age, you can be tested. Or if you have an underlying medical condition, regardless of whether or not you have symptoms, or if you've been in close contact with somebody who has tested positive for COVID-19, regardless of whether you have symptoms. And lastly, if you're a first responder or healthcare worker, regardless of whether or not you have symptoms, you can be tested here. So that's the physical criteria. Then we have some logistical criteria. Your vehicle has to have working windows. I'll explain in a minute. Also, make sure you have a full tank of gas. We saw many of those lines in the morning where cars were lined up. The last thing we want is people to run out of gas. They don't have air conditioning and it's over 90 degrees out. So plan ahead. And also, if you're going to get here early and get in line and you have small children, make sure you have water and snacks for everybody. Or if you need medication, bring what you need. When it's busy on this site, it can run about 4 hours from the time you get into the gate till the time you leave. Fortunately, the lines have diminished somewhat as we progress through the week. Hopefully that'll continue. We've been pushing out on social media and asking for our media partners to repeat the message when there's no line or no wait. Right now, there's no line, there's no wait. Also, all adults must have a valid photo ID. That's picture, name, and birth date. Children must be accompanied by a parent or legal guardian. That legal guardian needs to have the documentation to attest to the guardianship. Getting back to the car, full tank of gas, working windows. If those windows don't open and close fully, you will not be tested because of the risk of contamination. So you need to have working windows, and on top of that, 5 people per vehicle maximum. That's your first and second row in the car. No third row seat. If it's an SUV, they won't be tested because it puts too many people at risk to get in there and get to the people. So you may want to consider an alternative testing site. First 2 rows, 5 people, windows must work. If you're in a 2-door vehicle, there's got to be windows in the back that open and close. Lastly, no motorcycles, mopeds, or scooters. Another thing that we've seen on Sunday, there were almost 30 people that were turned away for testing because they did not meet the criteria. They were coming here for return to work notes. That's not what this test site is designed for. We don't get the results. We don't have a physician that can sign a back to work note. This test site was designed for initial testing, for people to come and get tested. Once you get those results, if you're positive or negative and you need a clearance, you need to follow up with your personal health care provider to get that back to work clearance. I know there are a number of urgent care centers and doctors' offices that are conducting follow-up tests and can provide the return to work notices. Quick look at the numbers. 13,830 people have been tested here at the Miami Hard Rock site since it started. Total in Florida, according to the health department today, 257,877 tests have been done. In Miami-Dade, there were 54,486, and in Broward, 33,421. That's a combined total of 87,907 tests that have been done in Miami-Dade and Broward. Of that, again, here at this site, 13,830 tests have been done. This is certainly one of the busiest sites. We've processed a lot of people for testing. The positives. Statewide, there are 25,996 positive COVID patients or cases. In Miami-Dade, 9,166, 3,960 in Broward. When you combine those numbers, because we are in the Miami-Dade Broward area, that's 13,126 positive COVID cases, which is almost half of the total cases in the state. That's why the Division of Emergency Management, along with the Florida Guard, is committed to continue this testing and encouraging people to come out and get tested if they meet the criteria. Any questions? There was a transition about a week and a half ago from a federal test site to the state. When the Division of Emergency Management assumed that transition, the governor was quick to act and increase the number of tests. We went from 400 a day to 750, or up to 750, depending on how busy it is. Previously, as a federal test site, HHS, the federal government, only allowed us to do 250 tests at the site. Again, the governor got more tests that were state tests. So what we had, this was a hybrid site, which was, I believe, the only one of its kind, where we were doing federal tests to the first 250 clients that came in, and then we were doing an additional 200 tests that were state tests at the governor's direction. So that's how we were testing up to 450 people per day. Since the transition, and we've had some capacity days, we're equipped to handle 750. This is a 7-day-a-week operation. There's no appointment needed. It is drive-through testing, and it is free. So make sure you meet the criteria before coming out.
People that are doing the testing or working the site, they move to other state sites, or they just stay stationary?
These are members of the Florida Guard that have been here. There have been some rotations and remobilizations, so we've had people come and go. You know, depends on where they're needed. I can't speak for how many rotations we've had. I don't have that information right now, but we have had rotations, and the Division of Emergency Management has rotated the incident command staff. Already we've gone through about 3 or 4 rotations. We are out here in anything but ideal conditions, 90+ degrees. Think of the guardsmen and women, the people taking the test collections in protective gear. It's very hot, it's taxing, anything but ideal conditions. So, but we're determined to make sure that everybody that comes here and meets the criteria gets that test as efficiently and professionally as possible.
Why do you think there's so much ebb and flow with demand? You had some days earlier last week where
we were open Easter. The question was, why is there an ebb and flow? That's a good question. We were open Easter Sunday, one of the only sites open Easter Sunday. The coronavirus doesn't take a break. We were directed to stay open, and we were committed to testing. If it was one person or 700 people, we were ready to accommodate whatever that was to get those tests done. Okay? The main thing I ask is to help us clarify the information, because we don't want people coming out here and waiting and not being able to get a test because they thought they could be retested here, or they had windows that don't work, or a car that couldn't withstand it. We had cars that were overheating in line. We had cars whose batteries died, cars that ran out of gas. And what that does is that creates a log jam in the line too. Further, when your car dies, you're out here, it's 90+ degrees, you're sitting in the car with the windows up with no air conditioning. That's just not safe. We've been lucky to have the assistance of the road rangers who've been out here to give people gas and help them get moving again. But once you do that, if your car breaks down, you will sit, you get pushed to the side, and once your car is up and running again, you will resume the line as where you stalled out.
So basically you guys had issues in the past.
This past week is when we saw the bulk of them with the transition to the new testing criteria. Obviously, everybody wants to get tested, and we're here to accommodate that. But we're asking for a little bit of patience, a little bit of planning and preparation, so we can minimize the inconvenience on the clients that come here to get tested.
What was day one of the transition? Was it Monday?
I believe it was Monday.
After, yeah, that's okay.
Yeah. Monday will probably be busy again, you know, but the message from the Florida Division of Emergency Management and everyone here at the Hard Rock Stadium site is to plan ahead, make sure you have a full tank of gas, working air conditioning, and your windows must roll up and down, no more than 5 people in the car. Help us out so we can help you.
Can you quantify for us, when you opened the criteria, what kind of increase have you seen percentage-wise? Or do you have
The
that?
question is, when we saw, did we see an increase when the criteria was opened up? Absolutely, we saw an increase. So there was definitely a need for it, and the timing was right. The transition was seamless because the crews that were here doing the tests transitioned right to the state site, and it's actually probably a little more seamless now because we're doing one test. Before, when we were doing federal tests and state tests, there was a transition. So at a certain point when we reached capacity on the federal tests and had to switch over, we had to take a brief pause, transition out equipment, supplies, and then